The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. If you're missing one tooth, a few teeth, and especially if you have a loose-fitting denture, you have to hear what my first guest has to say. He's an expert on the topic, Dr. Jin. Dr. Jin, welcome to the program.
Thank you, Randy.
All right, now before we get into today's topic, I know you brought photos and a few models, and some very graphic photos, by the way, good before and afters. Tell me about your practice. I mean, who's a typical patient?
Well, Randy, at our office, we see people from all backgrounds. We have patients who are young, patients who are in their senior years. We provide services from routine dental care, cleanings, all the way to cosmetic procedures, leading to root canal procedures. We provide treatments that involve dental implants. We also look after people who have gum disease.
Now, dental implants. We invite you on the program today to talk about dental implants. Tell me about your background and training. How long have you been in and around dental implants? And we've talked off camera. You say, I mean, this is a big topic these days.
Absolutely.
It's hot.
Yes. I've been around dental implants since 2003.
Okay.
It's been a life-changing procedure for many of my patients. Many of my patients have their lives have absolutely been revamped.
Really?
They've got a new lease on life because of this procedure.
Why? Because they can eat and chew, or what?
Basically, they've gained their freedom, Randy. They've been able to get back their ability to live. They're now able to go.
What?
They're now able to go out. They're now able to laugh. They're now able to swim. Prior to that, people who have dentures, they're not able to swim. They can't do the many things that you and I take for granted.
Interesting.
They go into a restaurant, for example, and ordering the foods that you want simply because you desire that food. People who have dentures generally can't do that. They're usually compromising their choices.
Did they tell you this? I mean, on the consults?
Absolutely, in confidence, Randy. They don't tell this to just anybody. I mean, who would? But when they do confide in me, I hear the troubles that they have to go through. They're basically prisoners of their dentures.
Okay, very interesting. Now, people still don't like going to the dentist. I mean, do you hear that every day?
Absolutely.
I mean, what do they say? What do they say?
Who does, Randy? For most people, especially those who have dentures, their experience with dentists have been, well, let's face it, not too pleasant.
I mean, do they say, no offense, I just don't like dentists? I mean, what do they say?
Yes, they actually say, I don't take this personally, doc, but I just don't like dentists. And that's a very standard comment. And it's to be expected.
What do you say to that? Because I know you're a funny guy. You know, we were talking, the whole studio is laughing at the things you say. And you say you use this with patients. You make them laugh.
Yes, I do make them laugh. I try to get them at ease. And I basically agree with them. I would tell them, yes, it's true. Who really wants to go to a dentist? Who wants to get their teeth worked on? Who wants to get frozen with a needle? I mean, frankly, who really does?
Did you always want to be a dentist?
No, I actually didn't want to always be a dentist. I started off as a high school teacher.
Is that right?
That's right.
Okay.
Yeah, and then I found my way into dentistry because it just happened to be the profession.
You love it, though.
Oh, absolutely. I live to change people's lives.
Now, you say changing people's lives, you know, and of course you're a dentist. You think the teeth are pretty important. But give me an example. If you're going to make a statement like that, changing people's lives.
Well, let's take this example. This is a fellow that walked into my office.
Wow.
He was referred, and when he came into my office, his teeth were in a mess. And he is a healthcare professional, Randy.
But that's rare. Is that rare to see something like that?
Well, actually, Randy, it's not very rare. You just don't see them because those people generally don't show you their teeth.
Okay, good point.
They walk around. And they usually have their hands covering their mouths when they smile, or they might not just smile. They just might not smile altogether. They might just keep their mouth shut.
Interesting.
And you might interpret them as being serious all the time, depressed, angry, but they actually don't mean to look depressed or angry. They actually that just happens to be the way they're compensating. And so when they show up at my office and they talk to me, that's when they tell me, Doc, I'm certainly not happy with the way my teeth are.
So this guy comes in, this man. Yeah. What does he say?
Well, this is a standard patient that usually seeks me out.
Really?
And when they seek me out, they come in with their teeth in pretty bad shape. Very often their teeth have lots of cavities. They're broken down. There's gum disease. And because there's gum disease, things smell bad. The social life is probably compromised. They don't go out very often. So with all that, with all those problems in the background, Randy, they come to me and
so those teeth had to go.
Oh, absolutely.
Okay.
And so I proposed to them that we could take out the teeth and we could give them teeth the same day, supported by implants, and that's what I'm proposing for many of my patients that come in who are frustrated. They come in and they say, "Look, doc, I'm tired of this. What can you do for me?"
Okay.
And so I give him
So what did you do for him?
Well, with him, we took out his upper teeth. With his lower teeth, we were able to salvage them. We were able to place crowns and hold on to the teeth that were in relatively good stead. The upper teeth, which were badly infected, we took them out, but we placed implants. Implants the same day, and we fixed him with, we provided him with fixed teeth the same day.
Okay, okay.
Okay, I wanted to show you the before and after. This is the before and after, Randy.
Well, he looks like a happy guy in the after.
Oh, absolutely.
Okay.
That's because he's got reason to smile. Look at the fella. Look at the before. And if you look at his teeth, you'll notice that they're very much broken down. He's very concerned when he smiles. He's very concerned about the way the image that he's portraying. He's very concerned about the infection that's in his mouth, the smell that it may exude. Whereas when you look at the after, it certainly has changed his life.
Even his face, by the way.
Absolutely.
It looks thinner in the after.
And this is very standard in dental implant procedures because patients basically start getting a sense of confidence. They start feeling better about themselves. They start taking care of themselves. And that's the norm, Randy. Very typically, patients will look after themselves a lot better.
Because I'm looking at that guy, okay, and going into this, I felt like there was a bit of an overstatement changing people's lives. But when you look at that, people have, I mean, did they tell you that people treat them differently because of their teeth?
Oh, absolutely.
Because he looks like a different guy.
Absolutely. He looks better. He feels better. And so people tell him that he's smiling a lot more. He seems more cheery and more approachable. And that's the norm. That's the standard reply we get. I'll give you an example of a lady that I just recently treated. I provided her with fixed teeth on top of 4 implants. And she called me that very night and said, "Doc, for the first time in my life, I feel like a human being again. In the past 30 years, I haven't felt like this, and I actually feel like a human being."
Really? They say that?
Absolutely.
So the denture wearers are pretty much not satisfied at all with their teeth?
No. Denture wearers,
because I know a few. They never complain to me. Well, I guess this is something.
The standard complaint denture wearers come, but when denture wearers find me, they typically say, "Doc, I'm here because I can't eat. I'm here because I can't smile. I can't do the things I want to do. I can't go to a restaurant and order the foods I want. I can't go to my friend's house, and when I do go to my friend's house, I'm concerned about what kind of foods they're going to serve." For many of my patients who are actually going through their second relationship, because we have people who are widowed or people who are divorced and they're starting up in their second relationship, permanent relationship.
Yeah.
They're very concerned about this because who really wants to wake up next to their significant other and have to contend with a denture? I mean, Randy.
Interesting. Okay, that's a good point.
That is a good point.
70-year-old, is young today.
70-year-old is young today, and believe it or not, a 70-year-old today is even more active than before. Then our parents, baby boomers, basically, they value life. Their quality of life is extremely important to them, Randy.
Now when I hear terms like, in your website, goodbye dentures, do you think that's the future of dentistry? I mean, and by the way, how big of a problem is dentures in Canada?
Let's answer the first question, Randy. There is a huge denture epidemic that's coming up. By the year 2020, 37 to 38 million people in North America will be stuck wearing dentures. That is a significant problem.
In the U.S., they say that we have about 20 million people with an upper or lower denture.
The numbers are growing every year. So one of the reasons why I'm bringing this up is because people need to know what options are out there. You see, Randy, people out there don't really know what to do.
But if it's as good as you say it is, okay, and you got tens of thousands of people probably just in your neighborhood that are wearing dentures, why aren't they all doing it?
I'll give you an example. I have a colleague who goes around, and I've actually done this. I'll go to my implant patients, my dental implant patients who actually have received their dental implants, and if I tell them, "Look, I'll take your dental implants back from you, and I'll give you your money back, a full refund. I haven't had a single person take me up on it, simply because they realize that the dental implants have absolutely changed their lives. They're able to eat, they're basically gained their freedom back. And here's the thing, Randy, many people who are denture wearers, they don't realize what they're missing out on. It's kind of like a microwave and a cooking stove. If you don't realize there's a microwave up there, you just put up with the cooking stove. But actually with denture wearers, there's a huge difference.
Well, they don't go to the dentist anymore.
No, they don't go to the dentist.
Could that be part of their lack of knowing their options, obviously?
Yes, that's certainly part of it. Because when they, let's think about the denture wearers. Most denture wearers, they've had bad experiences at the dentist's. That's where they had the root canals done. That's where they had their teeth.
That's a good point. Okay.
That's where they had their teeth out.
So the last thing they want to do is go to a dentist again.
Of course. They've had bad experiences.
But tell me this, though. Why is it what used to take you guys 9 months to do dental implants, to complete the process, now could take a visit or two? I mean, what's changed?
Well, technology has changed everything, Randy. We are able to scan a person's jawbone and look at them in 3 dimensions. We can actually determine where the bone is. And now, knowing full well where the bone is, we can literally make small incisions, insert the implant where the bone is, and the bone doesn't have any nerves in it. We can place it in, and then we could fixate a tooth on top of the implant, all at the same time, all at the same day, without any huge incisions, and those incisions, those huge incisions, that's technology from decades ago.
So that's why it used to be painful.
Absolutely. We don't have to go to the hip anymore for bone, because we can find the bone where with the scan, with a CT scan.
What if you're 80 years old though?
Even if you're 80 years old, my oldest patient is 89, and
really? For dental implants?
Absolutely, and I was able to.
Why did they do that? Why did they do that? I mean, why would an 89-year-old want to do this?
Well, Randy, if most of my patients who have dentures, they're baby boomers. They're baby boomers, and they value their quality of life. They want to be able to go out. They want to be able to live. They want to be able to go to a restaurant, order the foods they enjoy. They want to be able to swim. They want to be able to eat berries and not have the seeds get stuck underneath the denture. They want to eat leafy vegetables and be able to tear the vegetables in their mouth instead of having to swallow it whole. They want to be able to wake up with their significant other without having to contend with a denture.
Is it true, by the way, because you say that people are married and their spouse may not even know that they have dentures. They keep it hidden.
Absolutely.
Really?
With the fixed teeth, we can provide fixed teeth on top of 4 implants or 6 implants or however number of implants we need to place. But no, they behave and look just like your own teeth. You brush them just like your own teeth.
So pain is not something they complain about?
No, absolutely.
Do you think that keeps these denture wearers? If there's tens of thousands of people in and around Vancouver that have dentures, they're not doing it just because of their fear of pain?
No.
Is that one of the big fears, I guess?
I think that's
they're too old?
I think that's one of them. People don't realize that dental implants are so straightforward and so easy to place these days that a simple Advil or Tylenol, an over-the-counter Advil or Tylenol on the day of the treatment, is really all that's really necessary. It's a very straightforward procedure. And really, it's all about, Randy, I could teach you how to place dental implants. Okay. But it might take 10 years for me to teach you how to manage it if there's anything that's complicated.
Okay.
But generally,
because there's a lot to this. I mean, I went through your website. You teach other dentists about dental implants.
Yes, I do. And that's because dental implants are basically the next thing that the dental healthcare needs to embrace wholeheartedly.
Now, you work with their denturist. Tell me about that.
Very often I work with denturists who basically have frustrated patients. Many of these patients have been wearing dentures for decades. And at first it might be all right because there's adequate bone there. But over time, the bone starts disappearing. The denture starts pressing against the bone starts disappearing, the denture starts moving around, starts rocking around. And then the patient will get to a point where they really get frustrated and they can't do anything about it. And the denturist is also frustrated because they don't really know what to do. And those are the patients that usually seek me out, the frustrated patients who have been wearing dentures for a while. Now, I'm hoping that people listening to this program, people don't have to wait until they're in pain. They can actually prevent such complications from coming on by having some sort of fixed solution beforehand.
Okay, so goodbye dentures. Goodbye dentures.
Yes.
That's just, that's real.
That's absolutely
today.
real. That is real.
And people, do you think they count their teeth and think, I need a lot of dental implants? Because you say only with 2 dental implants, you could change somebody's life.
With 2 dental implants, a person's life can absolutely be changed.
Okay, show me their options. Okay, so a denture wearer comes in, where do they begin?
Right. A denture wearer, when they come in, their typical complaint to me is, Doc, I can't eat, my denture moves too much, it's flopping around, it comes out when I laugh, when I talk, when I'm in public, I'm concerned about it flipping out. Or, Doc, I'm always having to put on denture adhesive. The denture adhesive is obviously, it's altering my taste and I can't stand this. So,
do they hate that adhesive?
Absolutely.
Okay.
And what we can do.
So what are we looking at there? That's
we're looking at two dental implants, and we're looking at a denture with a couple of clips at the bottom. And this is what it looks like. Look underneath here. We can fit you with 2 dental implants, and then we can fit the denture, even your existing denture, with clips.
Little clips.
With little clips, and the clips engage these 2 implants.
Let me see this. Let me see.
And
is this a real?
That's really what people have, yes,
okay.
and it makes a difference.
So no more adhesive if they do the 2 implants.
That's right, Randy. If I could convince all the denture wearers to actually understand the benefits of having 2 implants to support their denture, just these 2 implants alone will trump the best fitting denture that any denture wearer has. I can tell you. And if I could convince denture,
even if you're 80, 89. Because my mother, in California, she and I think I told you the story. She's 73. Her medical doctor says you're too old for dental implants. They'll fall out. Because I told her you got to do these dental implants.
Randy,
do you think a lot of people think that? Is that true?
I think a lot of people think that, but I also think because a lot of people are misinformed. Dental implants are very viable. We can actually place dental implants in just about anybody. Unless you actually have a serious medical condition,
or in a cancer treatment, things like that.
Then you probably wouldn't be a good candidate. But if you're able to stand up, get out of bed, and show up at our office, I'm pretty sure you're a candidate for dental implants.
Okay,
yes.
So 2 implants. What's the next? Step up.
We can provide you with 4 implants, a stabilizing bar, and we could basically provide you with a denture with clips on it. And look at these.
So you're going to work with a denturist.
Absolutely.
Denturist to make this.
Yes, the denturist will work closely with me, and we can provide you with a denture that clips in place. Check this out, Randy.
Let's see this. That was no sound trick, by the way. So this is accurate, though. I mean, this is an exact.
Absolutely. You could bite into an apple. You could bite into corn on the cob. And
do they ever have a tough time taking these out of their mouths?
They do. And in those circumstances, we actually have to give them looser clips, so the denture can come out a little easier.
Do they look real? Because I feel like I could spot dentures walking down the street.
No, dentures can look absolutely real. They can even put fillings in dentures onto teeth to make you think that they're actually
Have they ever done that, by the way?
Absolutely, we do it all the time.
Really?
Yeah, we'll put in a silver filling just in one tooth down over here to make you so that when somebody looks at you, they think that that's your own teeth, because there's a filling there. It's got to be your own teeth. So yes, we can absolutely do that.
Now, your teeth, by the way, beautiful teeth. It's good to see a dentist with great teeth. Those are those dental implants?
No, I wish I could show you the dental implant in here, but these are all mine.
All right.
Having said that, I've provided my own dad with 2 dental implants, one on his front tooth, one on his molar. I've provided my own mom with the all-on-4 option.
Tell me about this. Okay, so this is all-on-4.
Yeah.
What is this?
Okay, with the teeth in a day option, basically we're providing the patient with fixed teeth on top of 4 or 5 implants.
So this is what it looks like?
Absolutely.
Okay. So this could be upper or lower. Are these upper by any chance?
Those are upper. And Randy, let me show you what the difference is with these fixed teeth. With these fixed teeth, the teeth are literally fixed in place. They don't come out, unlike the denture. You brush them and clean them just like your regular teeth. And check this out. You don't have the palate. Food starts tasting better.
Okay, so the denture wearer has to deal with the palate cover.
Absolutely. Look at a typical denture wearer. A typical denture wearer, when they take it out, they have to deal with a drippy denture. They have the saliva all around it. The palate is covered.
So 4 implants, they get a fixed set of teeth?
Absolutely, 4 implants.
Really?
Yeah. That's generally the norm. Sometimes we might have to put 5 or 6, but we can usually get away with 4 and that too, Randy, is a revolution. That is revolutionary.
What are the frequently asked questions? Okay, so the denture wearer comes in on day 1. What do they always want to know? What do they ask?
The first question they ask is this for real? Can you really do it? And the answer is yes. We can really give you fixed teeth in a day.
What's the second question?
The second question is, does it hurt? And the answer is no.
Okay, that's hard to believe.
It is hard to believe, but patients...
Well, it's relative. We should say there is some pain, I guess, so we don't get in trouble here.
That's true. The pain is minimal.
It's not something they complain about.
No, it's not. It's something that a typical Tylenol or Advil can take care of.
Really? Do they do that the next day?
In fact,
like an Advil?
In fact, most of our patients the next day don't even take any medication. On day one, on the day after treatment, they might take medication, the Tylenol or the Advil. On day two, they generally don't take a single thing. They're usually back at work or they're home and socializing out with their friends, and they can't believe
this teeth in a day. This is. I'm sorry to interrupt, but we're short on time, but this is a fairly new breakthrough. And I've been told you're one of the first guys, or the first guy in Canada, to do this. Well, is that true?
I'm not the first guy in Canada to do this, but I am one of the few people in Canada to be doing this, to be providing this service.
Okay, okay.
Yeah, it is revolutionary. It really will change people's lives.
So this is the future of dentistry.
Absolutely.
Is there
Randy.
such thing as a happy denture wearer?
I think there are denture wearers that cope. I think there are many denture wearers out there that put up with their denture. They kind of get used to it.
They forgot what it was like to chew or something?
Well, no. They've kind of put up with it. They've kind of come to expect the troubles that come with dentures. Food getting stuck underneath, it flopping around, coming out when they're laughing, and having to deal with debris or bones and nuts and grit.
So they can eat whatever they want.
Well,
I mean, after it's all done, like this all-in-for fixed set of teeth, they could chew whatever.
They can eat
hard vegetables?
No, they can't. They put up with it. They compensate.
No, I mean the dental implant patients.
Oh, the dental implant.
Once this is done, they could eat hard vegetables?
Absolutely. They can eat hard vegetables. They can eat steak. They can bite into the corn on the cob, off the cob itself. They could bite into an apple.
Do they tell you these stories, by the way? Do they come back and say, doctor, do they tell you their eating stories all the time?
Absolutely. All you have to do is just ask any of my patients. I have them on my website. You could listen to them yourself.
Okay.
It's true. These patients these are actual stories, and it really does change their lives. Do I have time to show you a few more?
Two more photos. Let's take a look at this.
Well, this fellow is a businessman. When he showed up in my office, he was frustrated because he had dental disease, he had gum disease, he had cavities, he had infection in his mouth. And he asked me what I could do for him. So I provided him with teeth in a day. We basically gave him a smile.
So all of his teeth had to be pulled out?
All of his top teeth.
Should I get a denture or should I get dental implants?
That's correct.
That's the question.
And he knew a denture was on the horizon. And instead of going with a denture, he said, "Look, Doc, I don't want to do the same thing my parents did. I want something that is fixed."
Okay.
All right. So look at the before and after, side by side. I want you to look at a few things on this guy's face.
Okay.
Look at a smile before and look at a smile after.
It looks very natural, that's for sure. I mean, there's no doubt about it.
And I also want you to notice how his face has changed.
So that's an upper fixed set of teeth. None of those are his on the after?
None of those are his on the after. No,
nice.
those are all teeth that are supported by implants. And he's a businessman, Randy. This is a very powerful businessman, and he came to me. He was frustrated with his smile. He was frustrated with his teeth. He was frustrated with his lack of freedom.
So did he ever smile before, or did he say that he didn't smile? Or
he smiled, but if you compare it to his after,
he looks like a different guy, by the way.
Yes, and that's what I noticed too, Randy. Many of our patients that receive these dental implants, their life has changed. They start looking better, and when they look better, they start feeling better.
There's a class difference too. If you look at one guy, if you judge a guy, I'm sitting here, it's like he's almost more educated or more sophisticated in the after.
Absolutely.
Very interesting.
Absolutely.
Interesting.
And Randy, let me ask you this question. If you were to look at the first picture, the before picture, and then look at the after picture, which person would you rather conduct business with?
Yeah, well, the second guy looks at least squared away or more enthusiastic.
That's
or
right.
Healthier.
Healthier.
That's for
more
sure.
Serious. He can be taken more seriously, and his life has improved tremendously.
Is this one of those things where they say, and we're almost out of time, where they say, I should have done this years ago?
Absolutely. Every single one of my patients say that. I wish I knew about this before. I wish someone told me about this. I wish I knew the options. I wish I knew about the actual discomfort that was hardly there. It's true. In fact, this is the standard. They come to my office, especially those that come to me with a lower denture. This is the typical patient. They come to me with a lower denture, and they'll say, "Doc, I can't stand my lower denture because the lower denture doesn't have the seal like the top one does, so it floats around."
Okay.
And then I provide them with the 4 implants and a fixed teeth, and I say, "That's great. Are you happy?" They go, "I'm ecstatic." They go home, and they typically come back in about a month or so saying, "Doc," I'll say, "Yes, what can I do for you?" They'll say, "I want to do my top ones." Now, check this out, Randy. They were originally satisfied with their upper ones.
Because of the suction, I guess.
Because of the suction. They put up with it, and they thought it was good enough. But once they realized the effects of the lower ones, they come back to me and they say, "Doc, the upper ones don't cut it compared to my lower ones. I want to get my upper ones done too."
Interesting. Now, do you floss them or do you brush them?
Yep, you brush them, you floss them, you can water pick them.
Do they forget their dental implants, obviously, after a while?
They do, because to them, it's just like their own teeth, and that is the standard. They come back and they go, "Boy, I wish I had done this earlier. I wish I had done this years ago instead of having to put up with a loose denture. The denture that keeps pushing on the bone and on the nerve, especially in the bottom." They'll say, "I wish I didn't have to put up with that."
So goodbye dentures.
Goodbye dentures.
Now we're out of time, but denturists will watch this show. Okay, what do you want them to know about what you're doing? Because you work with them.
Well, we want denturists to know that we're here. We're here for them. We're here to work with them. We're here to complement their treatment. We're here to look after the patients and the denturists as well.
Because they're the ones that make the top on these teeth. This all-on-4 procedure.
Yes.
Is that right? All-on-4. Okay.
Yes, they provide the teeth, and it is those teeth that we fix onto the implants.
Final message. We're out of time. Denture wearers watching this. Maybe they're still afraid of the dentist, worried about pain, cost, things like that. What's your advice to them?
Well, come check us out. Come talk to us, because we want to offer you a solution that you will be happy with. You don't have to compromise. You don't have to put up with all the troubles with your denture. We're here for you.
All right. I want to thank you so much for coming on the show. Good stuff. Excellent, excellent information. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, or point a friend in the direction of this interview, we'll have it on your website as well. They could watch it again there. Yeah. Or you can visit our website and just put in Dr. Jin, and you'll be able to see a retape play of this program. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.